And welcome back. From alcohol to pain medication, substance use disorder is a complex brain disorder causing continuous cravings for a drug despite the negative consequences. And joining us to talk about it is UofL Health's clinical manager of emergency psychiatric services, Mark Spivak. And Mark, thanks for being here, first of all. I thought this number was really interesting. 40 million Americans over the age of 12 reported struggling with this disorder. That is really interesting because we were talking about the stigma around it, and you don't think about 13-year-olds and up.
Right.
What are we talking about there?
Well, oftentimes the way that just general injuries, you might have a dental procedure, things of that nature could potentially send you down that road where you have
Dental
to
procedure. I don't even think about that. And then you kind of just get hooked on the cravings for that drug that you've been taking to help with the pain.
You do. And so we're trying to kind of help eliminate some of the stigma, educate the community about that, because in this platform, we're hoping to get people together, both people from within the healthcare community and outside helpers as well, so we can all chat about what is the best way to reduce the stigma for this population.
And I think that's so important because so many of these are, there are many things you could, have this disorder with, certainly, like, as we said, alcohol, other things. But pain medication, so many people with back surgeries, and knee surgeries, and all kinds of things that we hear about every day getting hooked on a certain kind of drug.
Oftentimes, that's exactly how it starts. Just a benign procedure. You're doing what you're supposed to do, but then all of a sudden you start taking the pills a little bit more than they were prescribed, and then you end up in this situation.
What are some of the most common misconceptions, if you will?
The biggest misconception is they're doing it to themselves. They want to do it. If they really wanted help, they could stop. And that's just not true. It is no different than any other disease. It hits chemical receptors, which we won't get into. We will at the symposium. But yeah, it's not of anybody's fault. Nobody wakes up saying, I'd like to be an addict today.
Yeah. And how do you address those kinds of issues with your own department? Education,
constant talking about it, making sure everybody realizes that this is not a choice and this is an illness just like any other illness. And we just constantly focus on that, making sure that we are therapeutic and our staff is welcoming to everybody that comes in.
I guess because it's hard to say, well, you don't need to be taking that drug so much, or, you just want to be like, well, that's not how you're supposed to be taking it. But then you've got to...
Yeah, it seems like it's so simple. Say, hey, just stop doing that and you're going to be okay. But once you get into the way the brain is wired and things of that nature, you find that no matter how much they really want, it's kind of like me with chips. I really enjoy chips. So no matter how many times my wife will tell me stop eating chips, I may sneak a bag or two.
You're eating the whole bag, right? Exactly. Many of us. Now, how does UofL Health collaborate with community resources and other healthcare providers to support the patients that have this disorder?
We partner with various entities within the community. 7 counties, they're a huge source of help for us, and they're actually embedded within our department. We also partner with the Healing Place, Reclaim Recovery, Vocal Kentucky, pretty much anybody that's willing to work with us, Reclaim Recovery, as I said, where those partners will actually come to the hospital, they'll pick up patients. We have very good relationships with them. So that's what we build on, making sure that we have good relationships with those that take care of these people.
All right, we want to mention the symposium that's coming up this Friday, November 29th. It's at the Crown Plaza Hotel for healthcare workers, substance counselors, and other interested individuals. And you're going to be focusing on what?
We're going to be focusing on collaboration with the partners that are in the building or in the hospital and outside, so that we're all treating the patients the same way. And we're going to teach each other where the barriers are so that we can all work as a team to get rid of them. So it's really just collaboration.
Awesome. So important. Thanks for bringing the information to us.
Thank you very much for having me. I appreciate it.
All right.